It's my first shift back after 2 days off, and since my ward has become the official coronavirus ward. I'm not sure what to expect going in tonight. Everything's changing.
My colleagues and I have been bracing ourselves for this storm, and we've been feeling very anxious about whether there's adequate preparations.
6 people have died and more than 100 health workers are infected.
I think some of my patients really have a sense of what this outbreak means for those of us working on the front line. It was almost as though they were coming in to say goodbye, and certainly good luck. You know, they really see, now I'm tearing up.
So I've just finished my shift on the floor. I'm a bit exhausted. It was my first shift in PPE. I'm talking about the masks, the plastic aprons, the goggles.
He's hypoxic, he's on hypo-oxygen. It's overwhelming, especially being on the front line. It's hard. It's hard to escape.
Tonight, on Four Corners, we take you into our world. The front line of the COVID-19 pandemic in Australia. And we share with you our greatest fears and our hopes.
I think I'm feeling what a lot of us are feeling. I'm feeling relieved that the curve is flattening. I think it's like a little miracle that our society's pulled off, because it wasn't looking like it was going in that direction.
So it's late March. Every morning I wake up, the first thing I do is I get my phone, I put my glasses on because I can't see without them, and I look at the numbers. And I literally hold my breath because every day I'm hoping that I start to see that curve flattening, and every day I don't.
Let's check the numbers.
The situation for GPs across Australia is actually, you can't even imagine how bad it is. We're in situations where practices, from the 3,500 practices I deal with on a daily basis, they don't have a single gown, we can't get masks. In fact, it's gotten so bad, we've actually gotten together and asked industry to help make hand sanitizer. It's just a joke. Nobody can access anything.
I hate this bit. Yep, over 1 million cases worldwide. 1,02,159. Is that right? I don't know. Dead, 51,000.
Everyone is COVID positive in these moments.
New York at the moment is hitting every 2 days, so it's doubling every 2 days. We double every 3 days. And you can track where that goes. It's exponential growth. The GPs are basically seeing patients that walk in and they don't know if that person has COVID-19, doesn't have COVID-19, and it's like waiting for a ticking time bomb to come in. If you look at vision online of other countries like China, they're in full hazmat suits with visors, gloves, double gloves, a gown inside a hazmat suit with 2 head coverings over it. We don't even get a single gown. At our clinic at the moment, we don't have 1 gown. Not one.
My husband and myself, we are both doctors. We are both going to be on the front line. I don't sleep very well right now, to be honest. I feel the burden of responsibility for my clinic and my GPs who work there. They are amazing people. And I lie in bed at night and all I can think about is, how can I get more hand sanitizer? How can I get more masks? Who can I approach to get equipment gear? How can I make equipment for them? I've still been searching for a lot of PPE, so protective gear. pretty much every day. I have just set up in the clinic a PPE room. So I've made the assumption that we're going to have to reuse a lot of our stuff. And so I've set up tables for each doctor. It's going to be marked for them which gear is theirs, what mask they use on what day. You know, it's all my Bunnings kit and my bits and pieces that I've sourced from wherever I can. I'm not a fearful person, and neither is my husband, but this is a disease that kills healthy people, that has a higher rate of infection in healthcare workers. And I need to look at the distinct possibility that either myself or my husband or both of us might get very, very sick from this. And one of us might not make it through this. I've been watching some videos of what doctors are doing across the nation to protect themselves with PPE in this current shortage. So a lot of them are actually wearing these face masks from just tool shops, Bunnings. They're actually not too bad. They're going to give some level of protection to aerosols. So I was stupidly excited to be able to pick up 3 of these babies for my nursing staff. I'm hoping that with this on, still a pair of goggles and the appropriate face mask, we're really going to decrease their chance of getting any exposure to COVID. There's a fairly good chance if everything goes well, I'm just going to look like a crazy doomsday prepper. But if I'm right, and if my colleagues are right, then I'm going to be really glad I had those masks.
I've been feeling very concerned and completely preoccupied with the upcoming pandemic. My colleagues and I have been bracing ourselves for this storm, and we've been feeling very anxious about whether there's adequate preparations. It's a Saturday, and I don't usually come in on Saturday, but yesterday I didn't get a chance to see all the new patients. I had 3 come in, and that's quite a bit in one day. I think my colleagues were a bit anxious about taking new ones on. I'm a visiting psychiatrist to U-Space, which is a young adult mental health unit. We're wondering whether we can even keep this unit open, with the risks entailed with having a whole bunch of 16 to 25-year-olds, not listening to the guidance and advice that we're giving them, because the tone outside of here has been inadequate and inconsistent. Consult rooms are always in difficult supply around here, so you come over here. How bad could it get? Well, many of my patients have bipolar disorder, schizophrenia, severe personality disorders, severe anxiety disorders like OCD. Many of them have been unwell enough to need a hospitalisation. What would have happened if we hadn't been open?
For me personally, I would have really, really struggled, because I was in a point in my life where I had a massive crisis and I really needed help. And
people with mental disorders are at increased risk of the transmission because of their symptoms, which make them less likely to adhere to all of the rules. The staff are very anxious. The levels of staff anxiety has been climbing, and I've had to spend time reassuring staff and listening to staff and taking on board what they say when they say, look, this patient or that patient is too dangerous here already. So we're already beginning to discharge patients who can't comply with the current rules.
Tonight, the National Cabinet met to consider a series of issues, and they related principally, firstly, to the issue of public gatherings. That advice has now been strengthened to say that it should be reduced to 2 persons in public spaces and other areas of gathering.
There are 5,000 or more public health workers in our states and territory public health units. I would like to give them a huge shout out tonight.
So I've just finished my shift on the floor. I'm a bit exhausted. It was my first shift in PPE. I'm talking about the masks, the plastic aprons, the goggles, and it's exhausting. When not going to be able to sustain doing whole shifts. We're going to have to swap in and swap out to make that sustainable for everyone. It's sweaty, it's hot, it's draining. The concept of your mortality is very foremost in your mind when you're thinking about this response. Everyone is very concerned for their own health, for their family, and for their colleagues. And that's a really difficult situation when you need to be protected at work and when there's not enough personal protective equipment to go around. When I'm lying in bed at night, the things that keep me awake most are, is everyone happy at work? What else do I have to do? What have I forgotten? And then I guess the question is, you know, when will I get COVID? When will I get sick? And what will I do when I get sick? Do I see my kids? Do I self-isolate for 2 weeks? Will I have enough time to make that decision, or will it be too late and that they will already have been exposed in a brief asymptomatic period? Will my wife, who's got asthma, get sicker than me?
Thank you for calling Canberra Hospital. In order to help slow the spread of COVID-19 coronavirus, general visiting is limited to 1 visitor per patient per day. Visitors must not enter if they are unwell with a fever, cough, sore throat or shortness of breath.
In terms of numbers around Australia at the moment, there's around 4,500. The latest numbers in ACT are actually 80. We have 5 or 6 patients in the Canberra Hospital at the moment out of those 80, and the rest remain at home. I'm just suspicious that I guess I'm not trustworthy of the virus. It could be, the calm before the storm is a good way of describing it. It could be a very busy period. If it does get really bad, then there's the potential that we'll have to make clinical decisions that are going to haunt us and are going to push us to our ethical limits. There's work going on at the moment to determine under what circumstances those decisions are made and who can make them. Those sort of decisions are almost never made by one clinician alone. They require agreement from a number of different, very knowledgeable, very experienced doctors. And I hope we don't get to the point of having to ration care.
96 new cases of coronavirus in Victoria, bringing the state's total to 917. There have been 4 deaths.
This is like wartime. We all need to play our part. Yes, people will die. We'll try and keep the numbers to the minimum.
Unless it's interchangeable with other ventilators.
So I've been directly involved in the efforts to source and create emergency ventilators. The difficulty we have is we currently have, say, 2,500 ventilators in Australia. How many do we need? And it really depends on the multiplying factor. If we have ×2, we're okay. In the UK, they're looking at ×10. We do not have adequate supplies to that. We're hoping the way things are tracking at the moment in Australia is we may be somewhere in the middle, but we may well need supplemental ventilators. So what I'm involved in is with companies and ventilator designs to get locally, not quite mass produced, but relatively large numbers of fairly robust, fairly simple ventilators to be brought into service when all our ICU ventilators are in use. The other role I will play, if the time comes, will be to oversee ventilated patients in our expanded critical care environment. So I have some concerns, as you know, I'm someone in their 50s, I'm male, I have type 1 diabetes, which increases the risks for me for this disease. My wife is saying, you know, you could bring this disease home. And I think that's the difficulty for a lot of people. There's the personal risk, but many of us actually think more about our families. We're used to working with it. We take everything we can. But the collateral damage of our work could be our families.
I'm a rural generalist. I work in the Shoalhaven region of New South Wales. I work in both primary care, so the general practice setting, and I also work in the local emergency department. I'll be running shifts in the local emergency department, so in charge of a team of doctors and nurses. I think our hospital resources are going to be stretched by the number of unwell patients with probable or certain COVID-19. I had a moment myself a couple of weeks back where we were really just sort of starting to realise the changes we need to make in the emergency department, and things were a bit chaotic, and I don't think we were ready that day. We were not ready that day for COVID-19 to come. And I was in charge, it was a busy shift, and I had just a moment where I thought, oh my God, I didn't sign up for this. And immediately I thought, well, actually, yes, I did. I did sign up for this. I took an oath to do this.
Bondi and the rest of Waverley Council has recorded 140 cases, the biggest geographical cluster in the state.
We have 146 COVID patients that we're currently aware of in our community and that we've been following. So we're calling them regularly, we're checking in on them, we're keeping an eye on them, but they're really well enough to be at home. And then we have a very small number of cases who are currently in hospital and who need that extra support. I never thought I'd be in this situation of fighting this battle against COVID right here, right now. I am an HIV consultant. I would suggest that he does that. I'm not a stranger to pandemics and to fear and anxiety from infection, but certainly I didn't think I would be here right now. Just the BCG study. There are many things that keep me awake at night at the moment. The thought of how the hospital may have to cope, the worry that we are prepared, the worry that we've done enough to be prepared, the worry that our staff feel protected. There are many things to pull together at this time, all of which need to be managed. I think the pandemic is affecting our collective mental health in ways that we don't yet understand. It goes against the grain of most doctors and nurses to separate families when they're very sick at end of life, and I think that's incredibly traumatic, that isolation of patients from their families, the isolation that healthcare workers may be experiencing from their families because they don't want to infect them, the isolation that we're all feeling in the community.
I've been getting a lot of phone calls about, a lot of letters and messages from other doctors feeling really unsupported and frightened and not ready, ill-equipped to manage this pandemic. They're calling me up in literally all hours of the night, sometimes 2 o'clock in the morning, 3 o'clock in the morning, all through the day. I'll get messages of people who are despairing about what's about to happen to them and what's about to happen to their families. My area of interest is trauma and post-traumatic stress disorder, and there's a really high likelihood we're going to have a lot of doctors experiencing PTSD and other traumatic syndromes after this.
COVID-19 would be the first thing I think about in the morning. And I do have a routine that on my way to work, I listen to the latest ABC News Bulletin.
More than 4,800 coronavirus cases confirmed in Australia.
Millions of workers could receive unpaid pandemic leave, and stranded Australians repatriated from Nepal on a charter flight to Brisbane. ABC News, good morning, I'm Susie Ray.
And it's basically 15 minutes of who's died, how many cases, what's happening, further lockdowns, and I probably shouldn't because it's not the right way to start a day, but I need to know what I'm going to work and what's ahead of me. On Monday we had 6 patients, and we can see that it's becoming more and more people are coming in, more people are sick. It's overwhelming, especially being on the front line. It's hard. It's hard to escape. It's like a nightmare you can't get out of at the moment. So, yeah.
Just arriving to work for night shift. It's my first shift back after 2 days off, and since my ward has become the official coronavirus ward. I'm not sure what to expect going in tonight. Everything's changing. So outside any of our coronavirus rooms, we have these signs that show us what exactly that we need to put on, whether it be mask, goggles, gown, and how to take them off. We have these stop signs just to stop unauthorised personnel coming in. And we want to reduce the amount of people coming in that are exposed and to protect our PPE. So we have this little station here. We have a contact sign-in sheet that we have to write our name. Did we wear the PPE? What time we went in and what time we went out, so we can keep a contact tracing of who's going in and outside the rooms. I have been emotional, more so in the last few weeks than I think I have since I began my career. I more feel emotional at home in the anticipation of going to work and what's happened, especially after having a couple of days off. You don't know what's different, are we in the next phase? In America, they have to use the same protective equipment for 5 days straight. So they put all their equipment into a little bag, and then when they go home and they come back and they have to reuse the same mask and gown, which goes against every infection control thing we've ever learnt. So I'm a bit fearful of us getting to that stage. We're already putting in place when we get there, in phase 2, for us we'll be wearing the same protective equipment for about 4 hours straight as we enter the ward, and going in a pharmacy room and around a nurse's station and using all of our equipment contaminated, which, like I said, goes against everything that we believe in. I'm very scared, I think, of when we get to the point where we've got nothing. We still have to come to work. People are still going to get sick. So it's 4 a.m. There's been lots of talk of known cases where nurses have contracted coronavirus in Australia and in Melbourne now. I wasn't really worried before, but now it feels a bit like a reality. I've had lots of family and friends calling me, saying how worried they are for me. Now it feels a bit real.
A coronavirus cluster has spread at Melbourne's Alfred Hospital, with a third patient in the cancer ward dying. 10 staff and 2 other patients have tested positive.
Hi, I'm Maurice Le Guin. I'm one of the intensivists at the Alfred Hospital in Melbourne, currently in full protective equipment, including the face shields, because we're about to do a procedure that involves the airway of one of our patients in the COVID pod. I guess one of the things that I've been thinking about a fair bit is just how this must look for patients that are awake and feeling short of breath if we're needing to put a breathing tube in, and just how scary it would be to, what I can only imagine must feel like having someone that looks like they're arrived, police, approaching you and telling you that they're going to take care of you and put you off to sleep.
I think if I develop symptoms that I think are consistent with COVID-19, I will self-isolate from my family. Every single day I keep asking myself whether I've got a sore throat or not, and I think every single time you ask yourself that, you feel like you've got a little bit of a sore throat, but it's just one of the realities of working in the current situation. Some of the things that I'm probably finding difficult as a father in this period, and one of them is feeling like there's a chance that I could be the person that actually got my family and my children sick. Thankfully, it does seem like the COVID-19 disease is generally more mild in children, although that's not universal. I think there's a very real chance that trying to deal with a large number of COVID-19 patients for healthcare workers will have a significant impact on their own well-being. And in this regard, we've already started to try and do some work within the intensive care unit, particularly for our nursing and medical staff.
We've unfortunately had our first COVID-related death over the weekend of a passenger that came off one of the cruise ships in our local hospital. We have had a sort of increase in our community transmission cases. So I did read on the news this morning that Port Macquarie is now considered a hotspot.
Welcome to the COVID-19 ward. This is a strange sight, a completely empty ward in preparation for COVID-19 patients. These patients may arrive today, tomorrow, or in a week, but what we do know is that they will be coming. But we are ready. I'm acting nurse unit manager of the newest COVID-19 ward. Right now on the Gold Coast, things are calm. We have 2 wards ready to go. We only have 1 full currently. So we had 18 patients on the 2nd ward last week, but we've managed to discharge all of those. And so it is calm here.
We just need a patient to go to C2 East. They've been cleared from COVID-19, so we can get them off the ward. Wonderful.
Whether it is a false sense of security and we are looking at the calm before the storm, I'm not sure.
So we have empty beds.
I left the house at 6:15 this morning and I'm only just getting home now at 5 o'clock. And what a difference 24 hours makes. So yesterday when I filmed, I showed you all a completely empty ward ready to go. Well, within less than 24 hours, we had 12 patients admitted.
Nurses are being yelled at and spat on while doing their jobs. It's also happening outside work, so much so that some have been asked not to wear scrubs to and from hospital.
It's extremely unfortunate. There is a very small minority of our community that haven't seen the value of their nursing staff. And it is very sad because those people may one day be the people that we have to ventilate.
If I could say something to the public about the treatment of any healthcare workers, regardless of the situation, is we are here to help you. We're probably very tired and we are feeling very stretched, and you need to understand we still need to get to and from work. We still need to get our groceries. We still need to go about our lives. These are real challenges that are going to affect our mental health, really. If it was a finite thing that we could say, it's going to be like this for 4 weeks, buckle down, we can do this, that would be okay. But we're looking at maybe 6 months of this. We'll need support from everyone who can.
It's been another day of sweeping changes to the way we live here in the Northern Territory. Our borders are now under police guard with strict controls that will remain in place for the next 6 months.
At Alice Springs Hospital, approximately 70% of admissions are Indigenous people. And the Indigenous population of Central Australia is incredibly vulnerable. There's a huge amount of chronic disease and many morbidities in very young people compared to the rest of Australia. So comorbidities such as ischemic heart disease, diabetes and other chronic conditions are significantly more prevalent in the Indigenous population, and these occur at significantly younger ages. And we know that these diseases are the diseases that make people very high risk for complications of COVID. This is a population that, if it comes here, it's just going to be atrocious. There's going to be so much death. We're going to lose so much culture. We're going to lose, whole language lines will be lost. It's almost, I guess it's almost too hard to think about.
Can you find a table full of drums?
I've got 2 kids, a 2 and a 4-year-old. I know I'm at high risk of being exposed and I'm at work, and that's part of my vocation. It's part of what I've chosen to do, but I hug them a little bit longer each night when I put them to bed at the moment because I'm so scared for my health and for their health.
Almost exactly 2 weeks ago now, I found out that I had admitted the first COVID-19 positive patient to our unit. And whilst the care of that patient was fairly standard, he unfortunately did pass away. And it's fair to say that his death has had a fairly significant impact on our staff, including myself, on how we feel that this pandemic might proceed in the coming weeks and months.
I've just found out that we have reached the milestone of triple figures for cases that have been diagnosed in ACT.
So I'm going to be heading into work. Still got a lot of organisation to do where things are moving along and they're moving relatively quickly. On the agenda today is having a meeting about the ICU bed situation. We need to increase our ICU bed numbers. And the ACT government this morning announced that the location of their temporary pop-up $23 million emergency department, and that's going to be on the oval across from the hospital, so that's nice. Anyway, hopefully I'll have something actually exciting to talk to you about later on. Yes, Alice, do you have something to say?
I don't like the coronavirus because the people who have it, they might die.
Yes, they might die.
Coronavirus means this Easter will be different and we will be staying at home. And it's important because we cannot undo the tremendous progress we have made together in recent times. So this Easter we are staying at home. Don't travel, don't go away.
I'm at work at Shoalhaven Emergency Department on a night shift. It's been a busy week. There's been good news as far as the COVID statistics. Not so great news for us in the Shoalhaven in that we are considered a hotspot here in Nowra for community transmission. There's been a lot of talk about holidaymakers coming down to the south coast from Canberra and Sydney and elsewhere, and certainly I'm noticing a lot of cars on the road with out-of-town number plates. Talking with my colleagues tonight, we're all, I guess, in a state of flux waiting for the other shoe to drop. It's strange, we started with a couple of weeks of
high anxiety, and as the curve has flattened, it's a sense of anticipation of when it might be our turn for things to go bad, but hope that they won't. I think people will start to get complacent and forget about protective clothing and social isolation and feel like it's okay to get out.
I feel pushed to keep going. There's that urgency to do what we can so that we don't see the numbers that are in Italy, and we don't see the numbers that are in New York, and we don't see the numbers that are in London. We know the numbers will come. We just hope they come at a pace that everyone can deal with. Strangely enough, that's winning. Flattening the curve to have a steady stream of sick people instead of a mountain is winning.
I think I'm feeling what a lot of us are feeling. I'm feeling relieved that the curve is flattening. I think it's like a little miracle that our society's pulled off, because it wasn't looking like it was going in that direction only a short while ago.
Tonight, the Defence Force moves into a Tasmanian hospital plagued by coronavirus. Nearly half of Tasmania's 150 cases have been linked to the outbreak, which has seen the region's 2 hospitals close and nearly 5,000 Tasmanians put in quarantine.
As far as the community of Burnie and the northwest of Tasmania, people are anxious. Every time they get a common cold, they think that it's COVID. I think the Tasmanian Health Service was teetering on the edge of collapse as it was. We were already at breaking point. Throw in an event like this and the health system can't cope. We've also got a problem in Tasmania. We've got an ageing population, and this virus certainly affects the aged more than it does young people. So because of the hospital shutting down in Burnie, paramedics are under huge amounts of pressure. I think we're at extreme risk of being infected. Because paramedics have to sit very close to a patient, if they had COVID, it would be very difficult to avoid contamination. But after midnight, we're still seeing patients that need to go to Launceston, and we're driving huge amounts of distance, which I'm concerned will cause a fatality when a paramedic falls asleep at the wheel. We're not seeing any risk management of our fatigue. So at night, we're working 14-hour night shifts or longer if we get a shift extension. If somebody calls for an ambulance and you're the closest crew, you have to respond.
I'm just driving home from the hospital now. We've seen 0 cases over the last few days, despite marked increases in testing at our Bondi clinics as well as the hospital clinics. So that's incredibly encouraging for us in terms of seeing a reduction in new cases, and it's really meant that the level of anxiety in the hospital has reduced quite considerably. We do still have some patients that we are following, and some of those patients in the community need to come back up and get checked to have their oxygen levels measured, and that's what's going on behind me. One of our doctors there, Amy, just checking a patient who's come back in to have his oxygen levels monitored, and hopefully he'll be able to go back home later on this afternoon and possibly with an oxygen monitoring device for him to check his levels over the weekend. What the community is doing at the moment in the way that they're doing it is keeping us in the hospitals safe. It's giving us time. It's keeping the cases low, and it's giving us time to prepare and get ready. And that's an incredible gift that the community is giving us.
We have had a rate of increase of less than 1% a day for 7 days straight now. We now have a sustained and genuine flattening of the curve.
When I was first talking about this, it really did feel like we were standing on the walls of a castle. I used the example of Helm's Deep in the second Lord of the Rings film. We're really waiting for disaster to come, and we've been really lucky it hasn't come. Do I think we've overreacted? No, I don't know. I think it could have been a lot worse, and being over-prepared is much better than being under-prepared in this setting.
Coronavirus testing will be expanded to people without any symptoms during the next few weeks. The number of infections has fallen significantly, as has the number of people in hospital.
Since I talked to you last, the numbers have dramatically dropped, which is incredible. I think we're only having a few positive COVID-19 patients on the ward at any one time, which is definitely not the way we had expected. It's fantastic. I just worry that the general public can't hold out or won't hold out. I think because it's just so uncertain how long for. I mean, everyone's thinking, is it a few months? Is it the rest of the year? What's the future world looking like for us? So I think we just better keep doing what we're doing until we can find a vaccine or really just keep this curve going down.
We haven't really seen the numbers that we were expecting to properly change into a COVID-19 ward, which was going to change our model of care. So it's been a bit strange, a little bit surreal, anticlimactic. We have had some days where we've had almost 0 patients because we are only taking COVID-19 patients at the moment. So we'll see what will happen in the future when restrictions loosen up, whether we're going to see more patients coming in.
There's still only been 4 cases of COVID-19 in Central Australia, and that was all in patients who have come from interstate or overseas, so there's been no community transmission to date, which is pretty amazing and has really given us invaluable time here at the hospital to prepare for what's coming.
We can safely say at this point in time that we are in a much better position in terms of the COVID-19 pandemic than we thought we might be. We've definitely had to treat fewer patients in our intensive care unit and in our hospital system than we initially feared. And that's a fantastic result for our health system and obviously for our whole community. Over the next few weeks to months, we are going to be facing a different issue from what we thought we might be facing. I think we thought we might be facing an issue of having our whole health system completely overrun. I think that's less likely to occur. I think what we will be facing is a lot of uncertainty about how we should best approach the likelihood of local outbreaks occurring in our community and adapting our health system to be able to cope with that.
It looks like our COVID-19 cases are well and truly under control, and what a massive difference 3 weeks can make. We've journeyed as healthcare workers from preparing for the worst to having some cautious optimism about how the pandemic might unfold in Australia. So this looks like it's the end of the beginning chapter of COVID-19 in Australia, but it's not the end. And this looks like it will go on for many more months. We're about to plunge into the depths of winter, and with that will come a surge in flus and other respiratory illnesses, and coronavirus is going to make that much harder. But what we have shown in Australia is that we're able to change the way we work and live to be able to keep the number of cases under control. And the health system has had an opportunity to learn and to build up their resources so that they can cope with the surge in capacity. Australia is very well placed to be able to cope with the next chapter.